Welcome everyone to our CTE showcase session, encore session number 1. We're so happy to have you all here. Today we will be showcasing the pathways of EMT, nursing, and pharmacy tech. So we want you all just to sit back and enjoy and listen to all the information that's being provided. Students that are here, you can put your questions in the chat, and then we will have a session at the end. So stick around for all 3 presentations where you can ask your question aloud to the presenters. So enjoy yourself. And here we are starting with EMT, Mr. Casey.
Hey, good afternoon, everybody. So again, my name is Mr. Casey. I'm the EMT instructor here at Patterson. A little bit of background about myself. This is 29 years for me as a medic. I have 25 years as a firefighter medic, so I did 4 years in the military. Started like you guys did to a degree. I graduated high school, went in the military, became a medic, and just really found the passion for it. My program is hands-on. It is physical, it is physically demanding, and it is mentally demanding. Our books are they're advanced. I don't want to scare anybody away, but you have to be on the ball. I can teach you how to do this. I can teach anybody how to do this, but you have to give me your all. You have to give me your dedication to it. I do have some of the equipment up here that we do use. We have backboards, we have monitors, some of the medications we use. We have an extinguisher, BP cuff, helmets. Our program is designed for you to become a Maryland certified and a nationally registered EMT or emergency medical technician. We are partnered with Baltimore City Fire Department. Your senior year, you will actually take the MIFRE or Maryland Fire Rescue Institute program, which is through University of Maryland. If you take that program and pass, you actually come out with college credits, which will help you in the future. After your senior year, Baltimore City Fire Department has a program called Community Aid. It's kind of like a cadet program, but because you've come in through this program, they already know you. We have guest speakers come in from the fire department. We have some battalion chiefs. A lot of times, Chief Ford will come in and talk to you. He is the actual chief of the fire department. Very, very nice man. We take trips, we go to the fire academy. Sometimes we partner up with the JRTC program and we go to the 9/11 Memorial in New York for the towers. That's really big with us because we did lose a lot of firefighters that day, so that kind of holds a place in our heart. As for us, your 10th grade year, you start out in the introduction program. That's a lot of science. I get into the science background of this. We teach anatomy and physiology, in other words, about the human body and about how things work. I work with you with your writing skills, with your math skills. This isn't just one class. I incorporate a lot of different into it because as you become an EMT and as you advance further as a paramedic, you take these classes and you have to be able to write narratives, which is like an essay describing what you've done. As for the future with this, the program itself, you can advance once you get into the fire department, or if you want to pursue even higher education through the college, you can take your paramedic program, which is about 18 months. If you want, you can get your associate's degree, and then you can even move forward with that and take more classes. You can, once you become an RN, there's actually a really interesting your medic, there's a really interesting program called Paramedic to RN Bridge, where you can become an RN, a registered nurse, without having to go through all the classes. Because as a medic in the field, we actually do a lot more skill-wise than most nurses do, unless they work in like a trauma or an ER. But for the most part, we do a lot more of the hands-on skills all the time. So we really have to take the classes for the management aspect and, you know, some of the clinical stuff. But for hands-on, we're really advanced. Through the city fire department, I use them as an example. A starting salary for a firefighter EMT starts out around 36 to 38,000 a year. That's not hateful. Now, if you want to advance, if you want to take classes, the city fire department pays for up to 85% of your tuition. So if you take programs and classes that are fire department involved, and it doesn't have to be firefighter paramedic. You can get your business degree, you can get your MBA, your master's in business administration. You can take nursing, you can take the paramedic program. As a paramedic with Baltimore City, they start at around $70,000 a year. It's really, really, really good income for not even having a full college degree, just having a certificate. Work schedule wise, you can be assigned to different locations. For the city fire department, if you're on the fire side, in other words, the suppression side, you work a 24-hour shift, then you're off for 2, then you work another 24-hour shift, then you're off for another 2, then you work another 24-hour shift, and then you're off from anywhere from like 12 to 16 days. On average, you work about 10 days a month. If you're on the medic side of it, you work 2-day shifts, 2 night shifts, then you're off for 4. 2 days, 2 nights, you're off for 4. Then you come back in and work your 2 days, 2 nights, but then you're off again for another anywhere from 12 to 16. It's a very rewarding career. You do have to be people. You have to be able to deal with people. You have to be a people person. We deal with people in the best and the worst of situations. So you got to make sure you're physically strong, mentally strong, and emotionally strong. For us, when we get back in school, on Fridays, we do PT. We do some physical training. We take our rescue Randy mannequin and drag him up and down the hall. We lift weights, we run. We also incorporate mindfulness and meditation. I started that last year with my students when COVID hit, because if you don't learn how to de-stress, this will burn you out. I haven't been doing this for almost 30 years without some sort of meditation and relaxation skills. So I teach you how to meditate. A lot of it's based on the principles of what the Holistic Foundation does here, second period, when we take that mindful moment. But I teach you how to actually meditate and do your self-awareness. And it really, really is helpful. Every one of my students that actually participates loves it. They say the same thing. We feel great. We are relaxed. I wish we did this with more people. So it works well. Your 11th grade year, I kind of mirror the 12th grade year. I give you a lot of hands-on. You learn a lot of the skills. You learn how to take blood pressures. You learn how to use the backboard and how to secure people down properly. You learn how to put your equipment on. You learn what it's like to move around in your equipment with your air tank on. So it's a lot of hands-on in the junior year. There is book work, but it's more hands-on. I try to get you to learn all the skills. And then in your senior year, it is geared more toward the book so that you can take your test, you can pass your national registry. We have a lot of people, like I say, we are partnered with Baltimore City Fire Department. We also work with Howard Community College. I'm an instructor there. I teach EMT and paramedic through the college. And we also do some work with some private companies. There's a private ambulance company called ProCare that if you come out your senior year and you have your EMT, but you don't want to go into the fire department, you can go to the private service side, the private sector, and work with them. They're a great company. We've got some other companies we work with. We do some work with Bayview. I'm part of their hazmat team, part of their response team. So when we start doing drills again, like disaster drills, I've used students as victims. You guys have gotten to play roles. You've gotten to be moulaged, in other words, special effects. And there's a lot you get to do with it. So we do a lot of work. We do a lot of trips. We do a lot of hands-on. If in your senior year, if you're at the level you need to be at, there is a trip we take to the cadaver lab, which is where we actually practice skills on bodies. they're dead bodies, but it's part of EMT and paramedic. It's actually an incredible skill day where you get to use your live skills. Other than that, we're very laid back in here. I try to teach you how to work with each other. I know it sounds kind of silly, but you're in a career field where you deal with every different individual, different colors, different races, different religions, different sexes. And I teach you how to work with that, okay? I teach you that we're all one big team. We do a lot of stuff here. We go to other classes. Like when you start learning how to take blood pressures, I'll take you for one period and you'll go to somebody else's class and take the blood pressure of every one of their students. You get practice with it. You know, we don't just kick you out and tell you to go handle the world. We actually do a lot with it. Book-wise, like I say, 10th grade, we do a lot of anatomy and physiology, a lot. So there are days where I may come in with an animal heart and we dissect it so that you can see the different chambers of the heart, the different valves. We practice some classes for blood stopping. In other words, if somebody has a severe injury, you learn how to take care of that, how to stop that bleeding. It's a life-saving skill. The skills that you learn in here will go with you for the rest of your life. I've had students that have been in this program, but didn't want to become EMTs or firefighters, but while they were in college, they actually had to do CPR on a person. I had one of my juniors, this was a couple years ago, he lives in Baltimore, and a person fell out in front of him. He went unconscious and actually went into cardiac arrest. Here's this high school kid, a junior going into the senior year, that saved somebody from the skills they learned. We do CPR, first aid, AED. You'll take classes with FEMA, the Federal Emergency Management Agency. You'll get your incident command. You'll get some hazmat classes. You'll get some terrorism classes. You'll get a whole gambit, this huge spectrum of work. Because as a firefighter EMT and a firefighter paramedic, we don't have one job. Our job entails a billion different things. So one day you could be at the firehouse washing the equipment and waiting for a fire call to come out. The next day you could be going to elementary, middle school and talking about fire safety. And then the next day you may be going into homes and checking for smoke detectors. All right. We push this program for the youth of Baltimore City. We found in the fire department that we're getting a lot of people from outside of Baltimore City, from other states, Washington, D.C., Virginia, West Virginia, Delaware, that want to come and become city firefighters. Well, we started talking about it. We really wanted the youth of Baltimore City to become the employees of Baltimore City. You guys grew up here. You are invested in your community. So this is the perfect way for you to give back and to get an amazing opportunity. Retirement for the fire department is 25 years. So after 25 years, you can take a full pension and retire. And if you want to retire and do nothing, or if you want to retire and get into other jobs, you have plenty of time. If you want to pursue further education, they help pay for it. So there's a lot of different opportunities. Okay, so if you have any questions, please feel free to type them in. I am going to be kind of logging off of this because I need to get all the equipment in my room because we're not technically set up, and I kind of came in and wanted to show all the equipment off to you guys just to give you a little bit of a idea. Okay, so Ms. Brett, I'm going to hand it back over to you.
Hey, Mr. Casey, before you log off, there are 2 questions in the chat. If you can answer them real fast.
Go ahead.
Okay, so Patrick wants to know. Yeah, go ahead, Patrick. Oh, good. Children that want to talk. Yes, Patrick. Go ahead and ask him.
All right, because my dream in life to be a firefighter. I always want to be a firefighter since I was 7 years old. All right, my dream. I said my dream. Where's my question at?
You're good. You asked about the Army.
I said, do Baltimore City, do y'all take people after the Army? Because I want to serve in the Army.
Yep. And that's a good question. I actually started as an Air Force pararescue. When I became a medic, didn't make it through there, but I went through the medic program and loved it. Loved it. And then when I got out, I had military training behind me, and it made the fire department that much easier.
I know, that's why, like, I'm not saying because of the easier part. I just wanted to serve the country first, and then then become a firefighter, EMT.
That's awesome. That's awesome to hear, man. Congratulations. I'm glad for you.
Thank you. And that's it. Enjoy the rest of your day.
Dontasia wants to know if you can elaborate a little bit on, you talked about like a trip to the morgue.
Mm-hmm.
Yeah, can you elaborate on that a little bit for her? She wants to know if they're real dead.
Yeah.
Help me out, Dontasia, if I'm not getting your question answered.
No, it's okay. Kiddo, it's not actually the morgue. There's a couple companies in Maryland where people donate their body to science after they pass away. So it's a college level program that we do, but we're allowed to bring high school students in. The thing is, yes, they are dead people. You cannot see their eyes. Their eyes are covered. If they have any tattoos, they're all marked off, so we don't have any distinguishing marks. But you'll get to deal with the torso. It's almost like a CPR torso. So from like here to here is what you see. There's no arms. The head's covered. All tattoos are covered. But yeah, it's a true dead person that we practice on. As you get further into like the paramedic program, or if you want to get into like some of the advanced biology classes and advanced nursing classes, the cadaver lab is a very big part of the training. Okay, I think I got it.
I think so. So listen, if we get any more questions, since you have to log off, can I just email you the questions, or I'll drop your name and your email in the chat. So
they can either shoot the email directly to me, or if you can get their email with their question, I'll reply directly back to them.
Okay. So listen, listen, if you're on here, if you're a member of the class of 2024 and you still have questions about EMT, feel free to continue to put them in the chat as you think about them. And then I will make sure that we get it to Mr. Casey, but I'll also drop his email into the chat as well. Then y'all can just email back and forth. You could do it that way as well. Thanks, Mr. Casey.
Thank you for your time, guys. I want you to have a great day.
Okay, so really quickly for the class of 2024, just to remind you what we're doing on here. You, along with getting to take or having to take the classes that you need to graduate, you get to pick a career pathway. And it's a really exciting thing for you guys. And of course, if we were in school face-to-face, we'd be doing this a lot differently. But right now, we're trying to give you as much information as we can about the pathways that you have that are open to you to pick from. Please keep in mind that the pathway is a 3-year commitment, right? So it's not just like a semester-long elective class. It's a 3-year commitment. So we really want you guys to take this decision seriously. Maybe talk to your parents, talk to your guardians, talk to your friends, really think it through so you can make the best decision for yourselves. So you can go ahead and get a jump on either college, if that's what you choose to do after high school, or going right into the workforce. So up next is Miss Williams and Miss Bethay, and they are going to present our nursing program.
Hello, everyone.
Hello, everybody. I was having a little bit of technical difficulties there.
Hi, ladies.
Hello.
It's nice to see everyone. I'm going to share my screen for a moment. So I am Mrs. Williams. And the other young lady is Miss Bethay. We are from the Certified Nursing Assistant Program. I'm bringing up my PowerPoint. Sorry, guys. We'll be talking to you about Certified Nursing Assistant program. Again, that is at Patterson. We have been here a couple of years now. And myself and Miss Bethay, we see you throughout the program. So you see me your 10th grade year. You and I do Foundations of Nursing. Miss Bethay does your 11th grade year, which is kind of like your anatomy and physiology course. And then your senior year, you get to have both of us. So you get to come together with a group of your peers that have followed the program, and we kind of get you put more into gear of going into your clinical setting and the skills that you will need to prepare for that clinical setting. So what we've done today is we have a little short video to show you a piece of a CNA's life in a day. We had to cut it a little bit because it's a little long, so it's about 5 or 6 minutes. And then we will come back in and finish our presentation. Ms. Bethay, did you have anything to say before we start?
No, I do not.
All right.
Hospital. This is one part the hemodialysis center. I'm working in the thoracic and chest center today, so people with severe respiratory problems, they are on oxygen 24/7, and it is long-term care, so they're there pretty much till the end of the road. I go in, check to see who my teammate is, who my patients are, and if I have any showers, and if I do, I go get my stuff prepared. So this is what our bathroom looks like. Those of you who are new to nursing, this is a shower chair. This is for people who are able to stand, pivot, to sit in the chair. The up and down button makes the chair go up or down. Park makes the wheel stop, and the green button unlocks the wheels. So pretty self-explanatory.
Writing's not that
Sorry,
easy,
guys.
but Grammarly can help. This sentence is grammatically correct.
Usually we have about 12 or 14 patients, but 2 patients were added to our team. So we had about 16 patients, but on the thoracic floor, we work in teams of 2, so that's 8 patients each. So these are all my patients' personal stuff for her shower, so I just put it in a basket and take it with me to the bathroom. Once all of that is done, it's about 9:30 and it's time for my 15-minute break. And it's really easy to forget to drink water, so try to stay hydrated, guys. So by 11:15, it's time for my lunch break, my hour lunch break. I always go outside for lunch. I don't feel like it's lunchtime, like it's actually a break if you stay inside. So I went to the grocery store, got myself a little salad, as you guys can see here. And then I go to my favorite spot in the world by the water where I just sit down and, just relax for the hour before it's time for me to go back to work. And this is like 5 minutes away from work, so it really doesn't take me long to get there. It doesn't really take too much time away from my lunch. So this is just the employee area. So we eat lunch here. You can sit down and relax on break or make yourself a cup of coffee. And right here we have a water machine. By the time I do my second round after lunch, it is about 2:15 and I take my 20-minute break. And this is just a lounge area or dinner area for patients when their families come over. And over there is just the regular dining area for the residents. So I know this video wasn't as precise as I wanted it to be, but just in case you guys want an exact details of what my day is like or what my schedule is like, this is exactly what it is. I really hope you enjoyed this video. Don't forget to like, comment, and subscribe, and I hope to see you in my next video.
All right, guys. So that was the life of a CNA. Of course, she couldn't show you some of the things that she would normally do because it does violate HIPAA. So she couldn't show you her patients or any of their medical information. Oh, sorry, guys. So of course she could not show you some of that information, but me and Ms. Bethay thought it was a great way for you guys to see some of the things that you would do as a CNA and what that looks like. So some of the questions some people ask is, what is a CNA? It is a certified nursing assistant that can be a rewarding entry-level healthcare position straight out of high school. You'll get to deal with patients on a daily basis with their what we call activities of daily living or ADLs. You do not have to have a college degree. It is a certificate program. They can begin work shortly after training. For this program, it is the 3 years, like Ms. Brett was saying. You start off in the 10th grade and you complete in the 12th grade. What does a CNA do? The main job of the CNA is really to assist the nurses with patient care, some of the tasks of bathing, physical help for the patients who are not physically able to do some of the things that they once were able to do on their own, emotional and personal level. You will help the patients. A lot of times these patients are in facilities and they can't see their family members on a regular basis. So you kind of become a part of their family when you start to work with them on a daily basis. You would help feed them, prepare their meals, transfer them to and from the bed and the wheelchair. Also, CNAs take vital signs. Vital signs are things like your pulse, your respiration, weight, blood pressure. Additionally, they also offer a listening ear to the patients because a lot of times these patients do have concerns, especially when they're no longer able or capable of doing things for themselves. Some of them feel ashamed. Some of them deal with depression because their surroundings have changed. They're no longer able to live in their own homes. So you do become an intricate part of their life when you're a CNA, especially when they see you on a daily basis. As a CNA, you can work full-time or part-time. It is definitely a physically demanding job. You're doing a lot of lifting, moving, giving baths, toileting, helping patients around. If there's any incidents that happen and you're there, you're making sure the patient is safe in the environment that they're in. And of course, there are ways for you to increase in this industry. This is a great platform for you to start off if you want to go to nursing school. A lot of facilities, especially if you work for the hospitals, offer tuition reimbursement for you to go to school for your RN if that's what you want to do. Some of the facilities that you can work in are skilled nursing homes, assisted living, home health aides, and hospitals. And you can also do what we call private duty, where you go to a person's home and help them in their own home. Ms. Bethay?
Miss Bethay got kicked out, Miss Williams. She
Oh,
still
she got kicked out. Okay, so I'll continue. As a CNA, the things that you would need are a certification in the state of Maryland. You definitely have to have a certification. When I used to be in CNA, I did start off as a CNA through Baltimore City. I did this program in high school. Um, you did not always have to have a certification, but now it is mandated that you have to have a certification to practice in the state of Maryland. And to get that certification, you have to have 100 hours of lecture, which is just basically class time and getting the information that you need to know to be able to perform the job. And then also to have 40 hours of personal or in facility training where we actually take the skills that you learn and we actually go in and we perform those skills on real people. So it is very important that you show up for class because you're missing out on a lot of things if you are not committed to the program. And it's a lot of things that will help get you through, that will make you comfortable in that clinical experience. So for your first year, that's your 10th grade year, you would be with me in foundations. This is like an overview of the body. We talk about medical terminology. You get to learn about medical terminology. You learn about legal ethics. You learn about different jobs within the healthcare setting altogether. And then we do a general overview of the body systems. Okay. Then your second year, your 11th grade year, which is body structures and functions, that's when you go into the body systems even deeper with Miss Bethay. I kind of scrape over it a little bit. Miss Bethay goes into it a little deeper so that you understand fully how this thing we call a body really works. It is a great, great machine. I tell my students that all the time. The body can restore itself if given the proper things. And for your third year, your 12th grade year, which is your nursing assistant and your capstone. Your nursing assistant is where you're actually learning the skills and putting hands on when we're using our dummies in the classroom, or our patients as we call them. We also use you guys as the patients. You team up with some of your classmates and you guys work together to practice the skills that you will actually use in your clinical setting. Your capstone is what we would consider your clinical setting, is when we actually go over to Bayview Hospital, that is our partner, and we go on the floor every day for a week. You get to work with a certified CNA or a tech, because if you're in the hospital, a lot of times they become techs in order to work in a hospital, which is a training that the hospital will give you once they hire you. You're with a tech for a couple of days. And then your last 2 days, you are on your own. You have your own set of patients that you are responsible for, but you're not left alone. The CNA that you've been working with throughout the week is there to help you if you have any questions. Myself or Ms. Bethay is there, as well as Ms. Bailey, who is our industry partner at Bayview. This is, again, your hands-on piece, or what we consider your practicum, is where you're taking all of the information that you learned over the last 3 years and putting it into work, okay? Then we have the advantages of becoming a certified nursing assistant. It is a great way, again, like I said, if you're looking into the path of doing something in the health field, especially if you want to be a nurse, because you have the ability to do direct care. And you have the ability to connect with the patients on a one-on-one basis. And it allows you to work with doctors and nurses to actually see what it is that you may want to do. You may get into it and decide, oh, I don't think nursing is for me. Maybe I want to do occupational therapy, because sometimes you have to take your patients to occupational therapy, okay? You can work, again, in hospitals, nursing homes, assisted living, hospice, and private duty. And we also talked about them assisting with college, possibly. And lastly, we looked at salary for CNAs in the state of Maryland. As of January 26, 2021, the annual salary can look at to be about $29,756, which breaks down into $14.31 an hour. That's not including if you work different shifts. Some shifts you get what we call a differential. That means they add on extra money because you're working a specific shift. So that also has the potential to increase your earnings for being a CNA. And again, the salary can differ in different places where you go. And I believe that is all that I have for you guys. Questions and answers. I hope this was very informative for you.
Hey, Miss Bethea, are you back?
Yes, I am.
Okay. Do you have anything you want to add, or did Miss Williams, did she cover it all?
Well, I really didn't hear it because I got kicked out.
Oh.
But I'm certain that she covered everything that we need to cover.
Okay, that's a good point. Yeah, how would you know, right? You weren't even in here. Okay. So listen, if you guys have any questions about nursing, these two are your experts in this field. They will be here. Can you ladies hang around till
Sure,
the
I'll be
end?
here.
Okay.
Yes.
So they'll be here till the end. So if you have a question, if it comes into your mind, drop it in the chat. We can get it answered for you. And then they will also drop their emails in the chat, and you can just email them directly if that's easier for you, or if you think of something later tonight or tomorrow, or whatever you think of it. You definitely want to just make sure you get all your questions answered before you make this decision. So our last but certainly not least pathway.
Hold up, can I ask a question real quick?
Absolutely, go right ahead.
I was wondering, when are we gonna pick it today, or like when we get back in school?
So great question, and probably something I should have said, Patrick. So we have presented these pathways. We did it in February. We're doing it again in March. So we have all of our healthcare pathways today. You heard from EMT, you heard from nursing, and in a minute you're going to hear from Ms. Seymour, who is our pharmacy tech instructor. Next week, hopefully you guys can come back, because we'll be presenting graphic design. We'll be presenting cosmetic services. We'll be presenting band, because at Patterson, we consider that part of our CTE offerings. We'll be presenting
Business.
business. Thank you. I was like, where's Dr. Murphy?
Should I attend all of them, even though I don't want to do them, or is it?
We're gonna leave that one up to you, Patrick. I would hope that you would. But if you are like, okay, I really think I want to do something in healthcare. Like I'm reading what you're writing in the chat, and you seem super into EMT. And
would it be best for me? Would it be best for me to attend all of them?
I think so. In my opinion, yes.
So I'm gonna go off what you say. I'm gonna attend all of them.
Oh my gosh, a child that actually listens, Patrick. You're becoming one of my favorites. Coach Kelly told me I would like you, and she's right. All right, so Miss Seymour is now going to talk about pharmacy tech. That's our last presentation for today, and then I'll run down the lineup for next week and the week after again, and then we'll take any questions that you have at the end. Miss Seymour, you are up.
Good afternoon, everyone. I'm Ms. Seymour, the pharmacy tech instructor. Having a little technical difficulty, so Dr. Moulton's going to share her screen for my PowerPoint. All right, so today I'm gonna discuss some things about the pharmacy tech program. So in the pharmacy tech course, students learn the foundations of medicine and health science. They learn pharmacy laws and regulations. They also learn the different pharmacy calculations and the top 200 drugs and the different drug classifications. The students learn through lectures, projects, hands-on activities. You learn through work-based learning. We go on field trips, and we have guest speakers. With hard work and dedication, this course helps prepare students with the skills necessary to meet the course goals and to be successful in the field in the future, in the pharmacy field in the future. So the goals for the course is to become a completer of the pharmacy technician program, to successfully pass the Maryland State Certification for Pharmacy Technician, and also to successfully pass the National Pharmacy Technician Pharmacy Board exam. I'll talk about those two exams further on. So let's start off. You start off in your 10th grade year. So in your 10th grade year, it's very similar to nursing. In the 10th grade year, you are introduced to the foundations of medicine and health science. In this course, it provides you with an introduction to the pharmacy profession, including the history, the standards of practice, legal and ethical issues. You learn about the anatomy and physiology and the roles of pharmacy technicians. Students also learn the following topics through lectures, projects, reading materials. We do study guides. You guys do a lot of group work and hands-on activities. You go on field trips and you have guest speakers as well. So in your 10th grade year, you'll learn about the history and trends of healthcare. You learn about the different types of healthcare systems, the different careers that are in healthcare. You learn personal and professional qualities of a healthcare worker. That's what you guys will call soft skills, legal and ethical responsibilities. You learn your medical terminologies. You learn about the anatomy and physiology of the human body. And we also study nutrition and diets in the 10th grade year. Then you move on to your 11th grade year. That's when you're considered Farm Tech 1. In the 11th grade year, you learn instructions and functions of the human body, overviews and laws of pharmacy. You learn some of your drugs and drug therapies, and we start calculations. So with the drugs, like I said in the beginning, you have to learn the top 200. So what I do is I try to break it up. I give you the first 100 in the 11th grade. That's our goal. And then you get your second set of 100 in the 12th grade year. It always seems like in 11th grade year we always go over the 100 mark, which is good because that's less you have to learn in your 12th grade year. We also start pharmacy calculations more in depth. You learn the role, scope of practice, and the general duties of a pharmacy technician. You learn about your pharmacy laws and regulations. You learn about controlled substances. That seems to get all the students excited when we get into controlled substances, which is very important now. You learn about the different drug classifications, things you think you didn't know, you actually do know. And then we start learning our frequently prescribed medications. And also in the 11th grade year, um, just to mention, you guys have an opportunity over the summer to participate in a summer program called BAC, which stands for Baltimore Alliance for Careers in Healthcare, and it's just for allied health students and rising seniors, which are 11th graders in the summertime, and it's open to students that's in the nursing program, pharmacy technician, EMT. We've opened it up the year before last to some of the PLTW engineering. So, and they have a really good time, and you actually work in I think we have partnerships with 6 hospitals, and you actually work on different units in the hospital and you get hands-on experience. And it's through Youth Works and it's a paid experience. And then each Friday you do a mentorship, and I'm one of the mentors, and we get to know the kids really well, and you get to meet different students from different schools. And at the end of that summer program, we always take a college tour, and the kids seem to love it. We have a closing presentation, and the kids love it. So that's another thing that I push for my 11th graders to do, and they always enjoy the experience. Then you move on to your 12th grade year. Your 12th grade year is when I become a little bit stricter with you guys. In the 12th grade year, the pharmacy technicians, y'all learn the following categories. Again, we go more in depth with drugs and drug therapy, the dispensing process, medical safety, and quality assurance. We go over the drug classifications, your frequently prescribed medications, which is your top 200. You learn your prescription and medication order, intake, and entry. We actually do a run through of a whole pharmacy intake, from intaking the prescription all the way through the dispensing process to the pickup process. You guys learn how to count by fives using the counting trays and the spatulas, and it's not as easy as you think it is. We also do more calculations. And by the time you guys, most students say they're not good at math, but I love math and I'm gonna make you comfortable with math. Then we learn about sterile and non-sterile products, compounding, unit dose, and repackaging laws. Then, next slide. All right. So then also in your 12th grade year, you do your internship. So as a pharmacy technician, you must complete 160 hours of the on-job training in order to sit for your certification exams. So Patterson High School right now currently has partnerships with two partners, which one is Johns Hopkins Bayview Medical Center inpatient pharmacy. That's where you will get your inpatient experience. Then we also have a partnership with Walgreens Pharmacy. Now, Walgreens Pharmacy is your outpatient experience. So with these two, I always push my students to do both if their schedule allows them to. So if your schedule doesn't allow you to, I tell you pick which one works best for you. So at the Walgreens outpatient pharmacy, you will be working behind the counter. You get more customer service skills, and it is a more intense environment. Inpatient, that's when you learn how to make IVs. You'll be in the hood. They will teach you everything you need to know. Their goal at Bayview is to teach you everything you need to know to be a certified technician. And once you pass your certification, their goal is to hire you if you do a good job during your externship. Currently, I have a couple students that are still working at Walgreens. One student, she was offered her job offer on her first day of internship. And I have one student that works at the Walgreens down the street on Eastern Avenue. And when my students go there now, she trains them while she's in school at CCBC. She's doing amazing. She was one of the students that couldn't master counting by fives. So once you complete that, your internship of your 160 hours, the pharmacist in charge will sign off and stamp your last page of your application. And then we'll go on to this next slide, which is your certifications. So then as a pharmacy and part of the pharmacy technician program, you get the opportunity to sit for 2 certifications. Your Maryland State Board Pharmacy Technician Certification, that's your last page of that application, what I was telling you about in your externship that you have to get stamped and signed off on. And then you also will take your pharmacy technician national certification exam. We are partnered with NHA, so the students sit for the accept exam. The school pays for both certification tests, so all you have to do is show up and to receive your certification. So you're getting 2 opportunities to get your certification. Now, I control your state certification, and both exams are multiple choice, but don't think just because they're multiple choice that they are easy, because they're definitely not. But if you fail your state certification, you do get a second chance to retake your exam again. So that's the good thing about it. And I always tell my students to push to take for both certification exams, because even if you don't pass your national exam, but you pass your state certification, you are allowed to practice in the field of pharmacy as long as you stay in Maryland State. And then also, the students, you guys receive your CPR certification, and that is through Mr. Casey, the EMT instructor. All right, next slide. And that concludes my presentation. Any questions?
I don't see any in the chat for you, but I guess we can take questions from anybody for Miss Seymour for pharmacy tech, Miss Buffet and Miss Williams for nursing. I just dropped Mr. Casey's email in the chat because unfortunately he had to leave. So if you have any questions about EMT, you can just email him directly. But if there's any questions for Miss Seymour for pharmacy tech, or for Miss Buffet and Miss Williams about nursing, you guys can go ahead and put them in the chat or cut your mic on and say it out loud. That would be fine too. While we wait for questions, I can just let you guys know what the lineup is for next week. We're going to meet back up next Wednesday, the 17th, at the same time. The presentations will be from our cosmetic services instructor for graphic design, our 2 business pathways, and band. I think I covered everything on the 17th. The following Wednesday, the 24th, is the last session, and we're going to do the presentations for JROTC, for computer science, for Project Lead the Way engineering, for our brand new home builders pathway, and finally for Teacher Academy of Maryland. So that's what's coming up in the next 2 weeks. Dr. Moten dropped a link in the chat. If you wouldn't mind going ahead and just clicking on that link, just to give us an idea of what you're thinking about right now, what interests you. One thing I want to say, as I'm listening to everyone's presentation, one thing that I definitely think the class of 2024 needs to hear is a lot of these pathways, in fact, I think all of them that I heard today, involve some sort of internship, which is really cool because that's an opportunity to leave school and get some like real work experience, some paid, some not, but all leading to this certification. So one thing you want to make sure of, one thing you guys can do now as 9th graders, because I know that seems really far away, but one thing you need to be thinking of now is you need to make sure that you're keeping up in all your classes now, that you're doing your absolute best so that your schedule can fit these internships in it. In other words, like you don't want to kind of mess up now and then go through this really awesome pharmacy tech pathway and then not have room in your schedule as a senior because you have to take classes over again. I hope that makes sense. Like you just really want to put your best foot forward now so that when you're seniors, you can take advantage of all the opportunities that are presented to you in these different pathways. Because I know Ms. Seymour has internships at Walgreens and Bayview, and then Ms. Bethea and Ms. Williams take their students to Bayview. I know Mr. Casey, there's his students at EMT ride the Medic in their senior year. So you want to make sure you can take advantage of all those opportunities. So do your very best now so that you're able to do that as a senior. I'm not seeing any questions. So Dr. Moten, I guess
that's
all
our
you.
time, right? Well, we thank you all for coming, and especially Trent. Trent, this is your second go round, and you're coming again, and I thank you for that, Dontasia. So the same thing for you.
Yeah.
Thank you, Patrick, for coming and asking all of your wonderful questions. And thank you for everyone from North Avenue CTE department that are here, as well as in-house teachers. We really appreciate you coming out and supporting the CTE pathways at Patterson High School. And we look forward to seeing you next week at 3:45. Everyone have a good day. And for the students, don't forget to complete your interest form. Thank you all.
2024, see if you can bring your friends next week. And they can bring their friends. And they can bring their friends.
Yes.
See you guys next Wednesday.